Thank you, Chairperson. Good afternoon to everyone attending this session. It is a pleasure to be able to give a presentation at this 13th meeting of the African Society of Human Genetics. I would like to thank the local organizing committee, that is Dr. Syntia Nchangwi and her team at the Tanzania Society of Human Genetics, for inviting me. My name is Nchangwi Syntia, and I will be presenting on equity-oriented governance of genetics research in Africa. If genetics or genomics is to deliver on its promise of precision medicine, then the outcome of genetics research would have to be transformed into tangible clinical interventions, such as diagnostics, health services, analytical tools, amongst others. But for this to happen, it will need the concerted efforts of a wide range of stakeholder groups, including but not limited to research participants, researchers, healthcare workers, national governments, and commercial companies that will be able to support the development of new interventions or products. While there is acknowledgement and there is optimism of the promise of genomics to improve healthcare, there are parallel concerns that if care is not taken, genomics may widen health inequities, both globally and across socioeconomic strata within countries. These concerns are were based on observations around the limited inclusion of African populations in genetics research, differences in research and development capacity, including support for innovation between high-income countries and low and middle-income countries. There are also concerns around the missing African voice in the global genomics discourse and how these may impact genetics research priorities globally, and by extension, translation of genetics research such that we may end up not having sufficient genetic studies that are addressing the health needs or the disease burden in sub-Saharan Africa. There were also parallel concerns around inequitable global health research collaborations. And this was a major concern amongst genetic researchers in Africa. A significant progress has been made in addressing some of these concerns, especially the inclusion of African patients in genetics research and developing capacity for genetics research. Much progress has been made, especially with initiatives such as the H3 Africa. But at the beginning, these concerns were really pressing, leading the ethics working group of the H3 Africa Consortium to sort of develop a framework for the governance of genomics research in Africa. This framework touches on key ethical issues around broad consent, community engagement, equitable international research collaborations, and the importance of African intellectual leadership of genomics research that is ongoing on the continent. The framework was inspired by communal or solidarity-based worldviews that are predominant in sub-Saharan Africa. And therefore it is grounded in principles of solidarity, reciprocity, and consultation. An African ethic of interest at the time that this framework was being developed was Ubuntu, and many thought at the time that we needed an African philosophical worldview that we could use to analyze ethical issues in genetics research in Africa, as well as global health research more broadly. And so Ubuntu was the ethic of choice at the time. And we would all know that Ubuntu is an African communitarian ethic that is centered on solidarity. We've since done a conceptual analysis of the African worldview of Ubuntu to be able to identify principles that may be used to analyze the different ethical issues that I talked about at the beginning. And the conceptual analysis yielded quite a number of principles, including solidarity, reciprocity, shared decision-making, inclusivity, and open sharing. To be able to get an understanding of how the principles we identified from Ubuntu could inform the governance of global health research or genetics research in particular, we compared Ubuntu to two theories of global health justice. The figure on this slide presents some of the principles that we identified, including what they will mean for equity-oriented governance of genetics research in Africa. In this presentation, I will focus on three of these principles because they are of direct relevance to the theme of this conference, which is genomics and translational research to improve health care in Africa. The first principle I would like to talk about is shared responsibility. And a key question to us all as African researchers or African genetics researchers is that what are our equity-oriented responsibilities towards ensuring that genetics research in Africa or genetics research globally does not widen health inequities, be it globally or in our different countries. And I think that quite some discussion has gone into the identifying or discussing the equity-oriented responsibilities of different stakeholder groups. But we haven't really talked much about the equity-oriented responsibilities of African researchers or African genetics researchers. And I think it is important to reflect on this and to ask ourselves, what are our different, or what are our equity-oriented goals and outcomes in relation to our different projects? That is, how are the projects we are involved in actually addressing concerns of genomics and global health inequities? Two ways to think about this is to, first of all, ask ourselves the question, in our different projects, do we have defined equity-oriented goals and outcomes? Secondly, do all stakeholders in these projects have a common understanding of what these equity-oriented goals and outcomes are? If we are not able to answer these questions, then it becomes difficult to state clearly what we consider to be our equity-oriented goals as African researchers. When we did the conceptual analysis of Ubuntu and the two theories of global health justice, we identified three main equity-oriented responsibilities of African genetics researchers. The first is around furthering the ideals of health justice, both globally, at the level of the African continent, and at the national level, that is, at the level of our different countries. So what is our responsibility towards ensuring that genetics research is translated to advance healthcare for everyone? The second equity-oriented responsibility relates to decision making. And the third equity-oriented responsibility is about the equitable use and distribution of resources, such as genomics data, expertise and infrastructure for genetics across Africa, and benefit sharing. That is how our different projects respond to issues of access to new interventions or to genetic medicine services by study populations. So the first equity-oriented responsibility, which is around furthering the ideals of health justice, it lies more in the translation of genomics research to health benefits for study populations, especially worse-off populations. And there we are sort of tasked to identify what are these worse-off populations, and they may differ based on national demographics or on the disease on the study. And to sort of identify or to sort of start discussing how genomics could impact, or genomics research in Africa could impact on global health and global health inequities. We did a qualitative study where we asked African researchers about their perceptions on how genetics research in Africa could impact on global health and address global health inequities. The study identified priorities for genomics research in Africa from the perspective of African researchers. And the results can be grouped broadly into four main priorities. The first is around identifying priorities for genetics research and genomics at the level of the continent and at the level of the different countries. And what factors will sort of inform genetics research priorities? Would that be the disease burden, or would that be the cost-benefit ratio? So for particular diseases, will the priorities be different? So in that study, many African researchers were of the opinion that we should be able to identify what the priorities are, both for the disease burden in Africa as well as for specific diseases. The second priority was around human and infrastructural capacity for genetics. And there's been some advances in that area, noticeable advances in genetics research capacity in Africa. But one thing to consider is also the distribution of this capacity across the continent. So is it equitably distributed, or do we feel like it is concentrated in specific regions or in specific countries, such that there are other countries that have little or no capacity for genetics research or for genetics medicine? It is also important to sort of look at the distribution of the capacity at the national level, especially the capacity for genetics medicine. So where is it located? And are all population groups within the same country able to access genetic medicine services? The third priority area was about knowledge generation and translation. And the results of that study showed that it was important to be able to look at how we could integrate ongoing research capacity or ongoing genetics research to support genetic medicine services or their development in African countries. So how can ongoing genetic research in our different African countries be able to kickstart genetic medicine services where they do not exist? And where they exist, how can they support those services? Another area of concern was about trained personnel in terms of medical geneticists and genetic counselors. There was also the need to define or to develop regulation and policies that will support the implementation of genetics medicine in Africa. The last priority area based on that study was awareness on the role of genetics in health and healthcare. And this was about thinking about how we engage the public. So what is it the public already know about genetics and health? And what is it and where is the gap? And how can we as researchers fill that gap? At the moment, there is very little public engagement in genomics in Africa, and there are little or no models on how to effectively engage the public in debates or discussions around genetics and genomics medicine. There was also another area where the researchers thought that there was need for improvement and it should be prioritized is awareness of genetics amongst healthcare workers. And so a previous study had shown that many healthcare workers had limited knowledge of genetics. So that's the study we did actually highlighted that area as a priority for genetics research in Africa. And there's some ongoing work around that to improve knowledge of genetics amongst healthcare workers in Africa. The second equity-oriented responsibility I would like to talk about is shared resources. And this relates to the use of resources such as genetics data, and it is to reflect on our data sharing attitude and practices in Africa. How open are we as African researchers to sharing data, both with our colleagues in Africa and out of Africa? A second important resource that is key to how genomics may impact global health and global health equity is intellectual property models or intellectual property. And the priority there is to be able to identify models, IP, intellectual property models that would encourage innovation, but would not serve as barriers towards improving access to genomics innovation by people in Africa. And the third resource that we need to reflect on is genetic services. And that is how easily accessible are genetic medicine services to populations in Africa, and how are our different projects sort of ensuring that populations in Africa will, in the future, be able to easily access genetic medicine services. The final equity-oriented responsibility of African researchers that I would like to highlight is shared decision-making. And there are different stakeholders that should be involved in decision-making in genetics research in Africa. But for this presentation, I would like to highlight one particular stakeholder group, which are the resource providers. By these, I mean the study participants or the patients or our study communities. And the question is, how are we engaging them in decision making? At the level of sickle in Africa, we've learned quite a lot around the engagement of patients in genomics, in the governance of research. Sorry about that. Sorry about that. And so we've learned a lot about how to engage patients in the governance of research, where we've adopted a model of patients as partners. And what we've learned quite a lot from them, including that they would like to be meaningfully engaged across the research pathway, not only for specific activities. So one area where they were keen to participate was in determining research priorities. So for example, we had patients actually asking why gene therapy, why there are no ongoing studies on gene therapy for sickle cell disease, and that they would love to see that kind of research ongoing in Africa, particularly because they had read of successful cases of gene therapy for sickle cell disease in other parts of the world. We've also sort of learned from them that they would love to be involved in decision making around the use of data and to be able to inform public engagement models and to be involved in the design of public engagement activities at the very early stages. So in summary, it is important that as African researchers, we define our equity-oriented responsibilities for each genetics project that we are involved in, including how we are working towards furthering the ideals of health justice, both globally and across the different socioeconomic groups in our different countries. This is the end of my presentation, and I would like to really appreciate the African Society of Human Genetics, my colleagues at the Sickle in Africa Data Coordinating Center, and the GeneMap Research Group. I would also like to acknowledge the patient support group leaders in the Sickle in Africa Consortium, as my interaction with them has helped shape some of the discussions in this presentation. I thank you for listening.